Good evening, everybody. My name is Melissa Walsh. I serve as the Chief Operating Officer at the Massachusetts Life Sciences Center, and I'd like to introduce our next keynote speaker, Minister Edwin Poots. I'm also an alumni, I have to say, of Partners Healthcare, so it's a joy to be here tonight to witness this well-deserved recognition upcoming of Drs. Thier and Kvedar. The Life Sciences Center is the agency charged with the Life Sciences Initiative in Massachusetts. We're making $1 billion worth of investments in the life sciences in Massachusetts, and we have formed with some of our partners in Northern Ireland and Finland and in Catalonia to establish an organization that Minister Poots has become an honorary member of, whether he'd like it or not this week, known as NIMAC. NIMAC is an informal collaboration among those regions that's pursuing strategic partnerships among our respective innovation sectors. Recently, we've also welcomed Catalonia, Spain, as our newest collaborator in that alliance. We've called upon the expertise of both Dr. Joe Kvedar and Joe Ternulo from Partners Center for Connected Health often, and we thank them for inviting us to these important events today. The Partners Connected Health Symposium has become such a wonderful opportunity for NIMAC's representatives to join together in Boston every year to advance our work. Connected health is an important part of our agenda, and the brainpower and experience in this room will no doubt fuel our ongoing efforts. It's my pleasure to introduce one of the dignitaries from Northern Ireland who is here at the Senate President Therese Murray's invitation and who has participated in the NIMAC events earlier this week. Mr. Edwin Poots, Northern Ireland's Minister of Health, Social Services, and Public Safety, is here with us tonight. I've actually just returned from Northern Ireland myself, and I have to say that it was striking in my time there to learn how in such a short period of time Minister Poots has really garnered such significant respect from his colleagues and from his constituents. I also observed the familiar challenges that currently face Northern Ireland at a time of such significant economic crisis and appreciate the tough decisions that the minister is grappling with back home. His being here with us is a testament to his commitment to furthering collaborations, meaningful collaborations of mutual benefit outside of Northern Ireland at a crucial time for all of our economies and for our healthcare systems. I thank him for making space in his hectic schedule to spend some time with us this week. He has generously shared his wisdom and his guidance with us over the past few days, and I'm glad that you will get to hear from him tonight. Minister Poots has served as a member of the Legislative Assembly for Lagan Valley, as a member of the Lisburn City Council, and as Deputy Mayor of Lisburn. He was appointed Minister of the Department of Health, Social Services, and Public Safety in May of this year, after previously serving as Minister of Culture, Arts, and Leisure, or Leisure, as some may say, in the Northern Ireland Executive, and subsequently as Minister of the Environment. It's my pleasure to introduce to you Minister Edwin Poots.
Thank you very much, Melissa, for all of those kind words. I hardly know what to say now. And thanks for making it clear I'm from Northern Ireland. I wouldn't have wanted any confusion tonight, people think I'm from San Diego or San Francisco or someone else with my accent. It was quite an odd experience travelling on the flight over from Dublin. You folks wouldn't ever have heard of a programme called Stars in Your Eyes unless you actually came from UK. It was a UK programme in the 1980s. I was just a young boy then, still at school. But that programme, it was people who wanted to pretend to be Tina Turner or Bruce Springsteen or some famous pop star. They came to this programme and they went into this mist as the person that they were. And when they came out of the mist, they looked very much like the singers, and they sang very well, very like the singers. Whenever I got on the plane from Dublin to come to Boston, I was Minister for Health. And whenever I got off the plane, I was Minister for Health and the Economy. Now, that was a somewhat odd experience. It could have been worse, though, because the Minister for the Economy is actually a lady called Arlene Foster, And I don't think that even if the stars in your eyes, makeup artists and experts had all have been there to paint me up with makeup and put a nice dress on me, that they could have made me look like Arlene Foster. However, it is really good to be here, and the issue that we're talking about is an issue that we all need to take very seriously. Since taking office in May, I have had to look at some very severe challenges financially and where we're going with the health service, and we really do need to change the system to make it work. Health service in Northern Ireland is free at the point of need. It is also associated with the social service. It is all one body. It is one pool that buys in the services, and it is a totally and wholly integrated service. And the health and wealth agenda that we are looking at and that we are pursuing is one that we need to take very seriously. Collectively, health and wealth are closely linked, as is poor health and poverty. One only has to look at the situation in Africa, for example, and the poverty that exists there and how that impacts upon the people's health. But you don't need to go as far as Africa. You can go to places in Boston, I'm sure, or other cities in the United States of America, or I can go to places in Belfast, and you will see where deprivation is also closely associated with poor health. Indeed, we recently got a report from one of our staff about a bus route in Belfast. And in the space of less than 2 miles on that particular bus route, life expectancy went up 10 years from an area that had a lot of deprivation to an area that had a lot of affluence. So we need to recognize that health and wealth do have a close association. Individually, health and wealth are each facing their own challenges. And it's my view that every department in my government and every department in everybody else's government has a role to play in ensuring better health for the public. It's also my view that every government department has a role to play in ensuring that the economy grows. So I'm very pleased to be able to speak to you this afternoon on the subject of EU-US collaboration and its ability to drive healthcare innovation. Northern Ireland is a very small region in both EU and US terms, population of just 1.8 million people. And our region has one characteristic that I want to give to you today. We're outward looking. You will find evidence of that in various communities throughout North America. As travellers, pioneers and immigrants, people from Northern Ireland have made their mark on the United States of America. In fact, we would actually have 14 of your presidents who had an association or came directly from Northern Ireland. People like Ulysses Grant, Woodrow Wilson, Andrew Jackson, and many, many others. They were frontiersmen as well. So names like Sam Houston and Davy Crockett were also people that came from our region. And they were also people who were inventive. So Dunlop, Cyrus McCormick were people who settled in America who were great inventors. Indeed, we have great inventors who didn't come to America. People like Harry Ferguson, people like Frank Pantridge who developed the defibrillator. So there's a great inventiveness about people in Northern Ireland. And just 100 years ago, Belfast was one of the leading engineering cities throughout the world. In fact, the famous boat, the Titanic, was built in Belfast. And as they say back home, it was in perfectly good order whenever it left us. You can't blame us. You can't blame Belfast for the person who was piloting it. But as in Northern Ireland, we have sought to look towards collaboration with like-minded people from all over Europe and many of those who have came to settle on these shores. Collaboration is equally relevant today as it was all of those years ago. We have better tools than those who went before, with better infrastructure, communications, and of course transport. The challenges are different in most areas of life now, including healthcare. Life expectancy has increased significantly from the first time that the European settlers came to North America. But we're now dealing with significant challenges in chronic disease, which is so prevalent in our aging population. It is not our task just simply to prolong life. We have to improve the quality of life. We therefore need the best quality health care for our citizens. And this is not a challenge that any region in North America or indeed in Europe can ignore, nor is it a challenge that any region is facing alone, but it is one that we can address better through collaboration. This naturally starts at home for most of us. In Northern Ireland, my own department, responsible for health, social services and public safety, has been working closely with the Department of Enterprise, Trade and Investment to deliver health and economic benefits from connected health. The link between economic development as the profit centre of any country or region and the funding of public services is well recognised. What is not immediately obvious, however, is the ability of the public sector, particularly in health, to generate economic value whilst improving patient outcomes. The economic downturn has led to financial pressures which impact directly on our public health care system in Northern Ireland. At the same time, we are dealing with the demands of an ageing population, the increasing number of people suffering from long-term conditions which are very expensive to manage. Add to this the fact that people's expectations of what their healthcare can achieve are constantly increasing, and you can see the significant challenges that we face. It is well recognised that in the life sciences sector, that economic and health benefits will only arise through effective collaboration between the business, academic and clinical stakeholders, particularly in the areas of research and development. In taking any work forward, we should look to harness technology and connected health to optimise quality and safety of service delivery, improve efficiency and engage patients better in the management of their own health. Our local collaboration has achieved a number of positive results, which includes the introduction of a new £18 million remote patient monitoring project, awarded to a consortium comprising of Tunstall, Fold Housing and S3 in March of this year. This will benefit up to 20,000 patients over its 6-year life. It will commence next month, and it aims to have 1,800 participants by March 2012. From a practical point of view, this contract was not easy to achieve, as no individual provider in the market could meet all of our requirements. The market had to develop and catch up to meet the needs of the consumer, and following a tender process, we awarded the contract to TF3, comprising the 3 companies that I mentioned earlier. They now form the largest provider of telecare and telehealth systems in Northern Ireland and the United Kingdom. This project will allow us to create a connected health ecosystem where medical and nursing staff that have hands-on experience can collaborate with local and international researchers from both the private sector and academic sources for mutual gain. The collaboration between the Northern Ireland Departments for Health and the Economy will shortly be formalised in a Memorandum of Understanding, which will include a strategic action plan. This will be published shortly, and we are finalising discussions with key international stakeholders this week, which underlines the importance we place on international collaboration. Through this strategic action plan, we will deliver some of the key health and social care benefits that my own department needs, but through effective international collaboration, we will also make an important contribution to the economy of Northern Ireland. Over the last 2 days, I have participated in a number of events run by the NIMAC, the Northern Ireland-Massachusetts Connection, which now includes Finland and the Catalan regions as members. We had private sector, academic and clinical specialists exploring collaboration opportunities in areas such as diabetes, tissue engineering and connected health. And I am delighted that Joe Caverter from the Partners Centre for Connected Health was able to make an important contribution to this. Many of you will know that partners also run a number of collaboration programs in Europe. NIMAC originated through a discussion between the Massachusetts Senate President, Therese Murray, and my ministerial colleague, Arlene Foster, the Northern Ireland Economy Minister. And the goal to strengthen business and research collaboration between our regions now, of course, has expanded to include Finland and Catalonia. The research links between North America and Europe are key to developing new, innovative products and services which will transform healthcare delivery, particularly in areas of chronic disease management and prevention. I strongly believe that Northern Ireland, which is small enough to be used and develop innovative ideas, but is big enough to count, along with our European partners, have a key part to play in influencing European policy by sharing the experiences which we have gained. Through discussions with the European Commission, it is clear that they are equally keen to share their experiences with the United States and vice versa. Thank you very much for the opportunity to speak to you.